Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are also joined by the Most Reverend J. Mark Spalding, Bishop of the Roman Catholic Diocese of Nashville, and the Reverend Lisa Hammonds, Senior Pastor at St. John AME Church. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, Chief Steve Anderson of the Metro Nashville Police Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. As we head into the Easter weekend, a sacred holiday for many Nashvillians that is typically celebrated with family and friends, I want to remind everybody that your social distancing efforts are paying off and your sacrifices are saving lives. Now, as we heard from Dr. Jackson of HCA Healthcare and Dr. Graves of the Vanderbilt University School of Medicine yesterday morning, Nashville's public health policies, including the Safer at Home order, have and will continue to positively affect the curve of the coronavirus disease here in Nashville. But we are still at a critical time in our city's response to COVID-19. The best case scenario models we've seen do depend on all of us staying the course and continuing to flatten the curve of this deadly disease. This means staying at home whenever possible and only leaving to run errands that are absolutely essential. Now, this morning, I'm grateful to Reverend Lisa Hammonds of the St. John AME Church and Bishop Mark Spalding of the Roman Catholic Diocese of Nashville for joining us this morning to discuss the importance of practicing and celebrating our faith while also protecting the health and well-being of those we love. Now, our Safer at Home enforcement teams, comprised of personnel from the Metro Public Health Department and the Metro Nashville Police Department, will continue their patrols and investigations of Safer at Home order violations throughout this weekend. As a reminder, anyone can report a suspected violation of the Safer at Home order by dialing 311 or visiting hub.nashville.gov or downloading the Hub Nashville app. Now, as always, I urge everyone to visit covid19.nashville.gov to make a contribution, as you are able, to the COVID-19 Response Fund, which has been created to provide relief to Nashvillians facing hardships during this time. And you can also visit the COVID-19 website to find direct financial, mental health, food, and social service assistance through the COVID-19 Response Fund and local community partners. Now, as you run your essential errands this weekend, please continue to wear face coverings in public settings where other social distancing measures may be difficult to maintain. If you're making homemade masks for donation, you can drop them off at the Community Resource Center at 218 Omohundro Place, Monday through Friday, 9 a.m. to 3:30 p.m. Now, our community must celebrate this Easter weekend in a new and unfamiliar way because of the coronavirus pandemic. But I'm happy to report that some Nashville traditions continue, and the circle remains unbroken. The Grand Ole Opry is continuing to produce fabulous shows with proper public health protocols in place to keep bringing their music to fans worldwide. And tomorrow evening, Bobby Bones is hosting artists Trace Adkins, Jason Crabb, and T. Graham Brown on the Grand Ole Opry stage. You can watch and listen live from the safety of your home at 7 p.m. at opry.com, WSMonline.com, or 650 AM WSM. And with that, I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest information on the COVID-19 virus in our city. We now have a total of 1,224 confirmed cases with 13 fatalities. Now, this number is slightly lower than what I mentioned yesterday, and that's because yesterday we provided you with some raw numbers right off the bat, and after further analysis, we noticed that the total number of cases had to be adjusted, as some of the numbers I provided you yesterday were from surrounding counties. With that said, there are a total of 1,243 confirmed cases in our surrounding counties. This means that there are nearly 2,500 cases right here in Middle Tennessee. Of the Davidson County cases, 204 people have recovered and have been cleared. Our community assessment centers are open today. These centers are located at the Kmart and Murfreesboro Road in Antioch, Nissan Stadium, as well as the Meharry Medical College. These are drive-through locations where you will be screened and, if necessary, receive a test. These are open to all Nashville residents at no cost. The assessment centers are open from 9 a.m. to 3 p.m. Monday, Wednesday, and Friday. If you also think you may have symptoms or you want to get further information, you may consider calling our hotline first at 615-862-7777. This hotline is open 7 days a week from 7 a.m. to 7 p.m., and this is where you can speak to a medical personnel right away. If the medical personnel feels that you need additional screenings, they will refer you to either your local healthcare provider or one of our community assessment systems. Finally, yesterday we did see the modeling from HCA and Vanderbilt, and I believe we all felt that those are very informative. Later today, the Vanderbilt group will release a more extensive study in which the details of that study will be a little bit more clear. I believe this news is encouraging. The data shows that what you are doing here in Nashville is helping bend the curve right here in the communities in which you live. The data, however, does show that if we lift our vigilance and we stop doing the great practice that all of you are doing, that we may not have as good of an outcome. And so what I implore of you today is stay at home. Only go out if absolutely necessary. Continue your social distancing. Wear a face mask when you are going out. And if you are sick, please don't go out. Just because we are hitting the peak of this in the next several weeks, remember, that doesn't mean that we can let up. The peak is the point at which the highest number of people are infected at one time. We have to continue our efforts to have the peak come down, and we can't go out right immediately after the peak has been hit. So please remain vigilant and stay the course. Remember, we're all in this together, and I know this holiday weekend, many of us will be tempted to go out and visit with friends and have the traditions of Easter egg hunts and other great family and friend time that most of us have. But I just ask that you please understand that we're still not there yet, and please try to stay at home and do the visiting remotely. Think of your family and your friends and your neighbors. Stay at home and this will help keep you safe and keep us safe. Please spread the word and not the virus. I'd now like to introduce the Most Reverend J. Mark Spalding. Thank you.
Thank you, Doctor. Thank you, Mayor. Our faith communities have been praying for the mayor, for the governor, for our president, for everybody working together to address this virus at this time. Today on Good Friday, we keep in mind all our civil authorities within the very prayer of the church. And so we want all to know of our prayers for you. We want special prayers for our first responders, those working in our hospitals, our doctors, our nurses. Those are on the front line of this battle at this time. And we come with our faith, our hope, and our love in this moment. Good Friday teaches us in our tradition that death is not the end, that in Christ Jesus, he overcomes by the gift and the sacrifice of himself. And we see so many people at this time sacrificing, even suffering for others. And what a Christ-like life they are living. And when you live like that, any of us live like that in sacrifice and even suffering for another, we unite ourselves with Christ, and Christ unites himself with us. And we conquer, we overcome, we share a victory. And that victory is life. And so as we come into these next few days and we're challenged by our separation physically, remember we're together spiritually, together in Christ, in our tradition. But whatever tradition you have, we're together as a people right now, though separated physically. We have a communion with and for each other that is great in Nashville, great in Tennessee, and great in the United States of America. God has truly blessed us. And on this Good Friday, in which we remember a wonderful blessing given to us by a man who committed to doing good no matter what. And he gave of himself for others. Let us keep that in mind as we live out the next few days. For we do celebrate Good Friday, and we especially celebrate Easter in that victory of Christ. May God be with you and with your families. At this time, I invite Reverend Lisa Hammonds to come forward.
Thank you, and good morning. I appreciate the invitation to offer brief words about staying faithful in the midst of our safer at home orders. As the pastor of the oldest African Methodist Episcopal Church in the state of Tennessee, I can attest to the need to remain faithful in the midst of these new times in which we find ourselves. For St. John AME Church building was completely destroyed in the March 3rd tornado. While we are experiencing displacement and devastation, as well as the effects of COVID-19, like so many of our 37208 neighbors and beyond, we are encouraged and find hope in our faith. A faith community typically grows not in isolation, but in community. However, in the sentiment of the Greek physician Hippocrates, desperate times call for desperate measures. To this end, it is absolutely necessary for us, people of faith, to practice safer at home protocols, ensuring our safety and security, as well as for others with whom we live and serve. While sheltering at home, I invite you to meditate on these 4 R's. First, remember. Remember what initially drew you to faith and renew that commitment. For it will be those memories and experiences that you've had since then that will grant strength and courage to carry on in these trying times. Second, reach out. Reach out and share your faith with others through the internet and phone calls. For we really are stronger together. Third, refresh. Refresh by reading sacred materials or engaging in holy play of dancing like no one is watching, singing at the top of your lungs, or laughing unabashedly to receive needed respite from fear and stress. And finally, revel. Revel in knowing that where we are now is not where we will always be. For our present moments will yield better tomorrows. After all, that's the promise of faith. And so, beloved, let's remain faithful by staying safer at home. While there, remember, reach out, refresh, and revel in your faith. Many blessings to you and to yours.
Thank you, Reverend Hammonds, and thank you, Bishop Spalding. We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Julia Palazzo.
Good morning. Thank you all for this update. I have a couple questions. Chief Anderson, will more officers be out on Sunday just to make sure people are following the safer at home order for Easter? And also, Dr. Jahanger, Vanderbilt's results being released later today. Will that talk about how Vanderbilt's model of the metro area compares to the state models? And also, I know you guys spoke briefly yesterday about potentially extending the safer at home order. Do you have a timeline of when that decision will be made? Thank you.
Let's start with Dr. Jahangir.
Thank you. I have not read the complete Vanderbilt report, so I can't speak to exactly what it will show, but my understanding is it will address state and city data. The mayor and his team and I and Dr. Caldwell and others are constantly looking at the data, and the science will drive those decisions. And so we're constantly evaluating that, and we'll get to you with an answer as soon as a decision has been made by the mayor, Dr. Caldwell. And I'll defer to Chief Anderson, please.
We do know that Sunday is likely to attract more crowds because of the nature of the holiday, the event. So we will have more officers. We're already running additional officers for the tornado and the aftermath of that, and extra patrols based on the pandemic. So yes, there will be more officers on the street on Sunday.
Holly Meyer, please go ahead, Holly.
Thank you. Good morning. I was wondering, do city leaders know if there are still churches and other houses of worship meeting despite your guys' repeated calls to stay apart and social distance? And if so, do you guys have a sense of how many they are, and what is the city doing to address that?
The question is about houses of worship that may still be meeting despite the safer at home order, and what we are doing to address that. Dr. Caldwell.
Good morning. We have received no complaints of any activities, and we do want to remind you that Hub Nashville is available on your phone, as well as the covid19.nashville.gov website. Thank you.
Harriet Wallace. Go ahead, Harriet.
Yes, good morning. As you all just mentioned, we still don't know yet what the end date is exactly of the shelter or safer at home order. Any words that you all have for those beyond just the direction of the order? Any encouraging words that you all can share with those who have families that have not worked for weeks, who are trying to figure out how to feed their families? What can you say to them as there's seemingly no end right now that we can see? Thank you.
Dr. Jahangir.
I understand that how challenging that is, and I think we, as I personally, I know Mayor Cooper, we constantly think about that and discuss that, and we're grateful for everything everyone is doing, because it has really helped us be able to hit a point where I think sooner than later we'll be able to open our society and communities back. And our hope is our federal and state and other partners will be able to help make people a little bit more whole once we get to the other end of this. But listen, we all understand how challenging this is, and we're very much believe that that's an important thing for us to just recognize here. Thank you.
Nancy Ammons. Go ahead, Nancy. Nancy? Blake Farmer with WPLN. Blake?
Yes, thanks for taking my question. I'm not sure if this is for Dr. Jahanger or someone else, but I wanted just a little bit of color on the drive-through testing centers. Are they less busy than you all might have expected? And I do want you all to make this clear. Are you all still asking people to call first, or can people just show up, get tested, whether they're insured or not?
Thank you, Blake.
So Blake, thank you for that question. I'm really proud of how our assessment centers have done. we just opened again today. We've seen over 1,550 people in 5 days of operation. We have tested about 1,000 individuals, and the turnaround on those labs are about 5 days, 6 days. We believe that, and I have to say, we've been able to see people with a wait time of 5 to 10 minutes. So I'm actually very proud of the operations of it, and they're free to anyone that wants them. So I think that's just superb. We encourage anyone that may feel like they have symptoms to call our hotline for information, right? Because I think that is an important part that probably has helped. We've taken about 4,500 calls. So I think that has helped maybe not people who may think they need a test or assessment to not come to it if they don't need one, because that's part of how it helps us flow better. So no, I actually am very proud of the system that we've established. I think it's worked out really well, and I encourage anyone that has any concerns to call our hotline first, and if directed, come to our assessment centers. But no, I'm very proud of the numbers and how we're doing, and we'll keep doing them as long as the community needs them. Thank you.
Let's try Nancy Amos one more time. Nancy, can you hear us?
Hi, sorry, my connection's not so good this morning. Can you give us an update on the fairgrounds? How many people are there? Have you had any people testing positive? Can you tell us a little bit more about the layout of how you have?
Sorry, Nancy. Can you repeat the last part of your question? Are you still there? Well, we caught the how many people are at the fairgrounds and the layout.
Sure.
An update on the fairgrounds. I'm sorry.
All right, Nancy, thank you for that question. As we've described previously, just for everyone to understand, that the fairgrounds has two separate buildings right now. One is for unhoused individuals who want to practice social distancing, have access to ways that can happen, have food, entertainment, and so forth. We have a second shelter for individuals who are ill and maybe have been tested but don't have results, and then within that same area at a different location for people who have tested positive for disease. Currently, there are approximately 200 people in the unhoused shelter, and in the second shelter, there are 3 individuals who are awaiting results, 1 individual who's tested positive. That shelter is also staffed by medical personnel. If a higher level of medical care is needed, they're right there. And then the other shelter is staffed by volunteers. So so far it's all going well, and I think it's been a good service. So thank you.
Those are all the media questions we have this morning. There are no scheduled COVID-19 press briefings this weekend. Press updates will be emailed to local media on Saturday and Sunday morning as usual, and all Nashville residents can read about any new developments at covid19.nashville.gov. Broadcast press briefings will resume Monday morning, April 13th at 9:30 a.m. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.